Hey guys, this is Dr. Hub. Today we'll look at the myringotomy. So here, first we need to know what are the indications of the myringotomy. The myringotomy indications is that ASOM being the main indication. So this has a severe ear pain. Characteristics are there is severe ear pain, and what is it associated with? There is a bulging of the tympanic membrane. There is bulging of the TT, that is a tympanic membrane. Then comes there is incomplete resolution. There is incomplete. There is incomplete resolution, and this is with opaque drum. This is with opaque. There is opaque drum and persistent conductive deafness and persistent conductive deafness. The next point will be there are some complications of the AOM. And what does it include? This may include the facial paralysis. There can be the facial paralysis. Then comes the labyrinthitis. Next, there can also be due to the meningitis. And this will be the bulging tympanic membrane with the bulge of the tympanic membrane. Next indication of the myringotomy will be the serous otitis media. So next there is oro-otitis media, and this will be nothing but to drain the fluid. So to drain fluid and to drain fluid and unlock the eustachian tube. To unlock the eustachian tube. Then comes the atelectatic ear. So this is nothing but there is a grommet is often inserted and this will be for the long-term aeration. So long-term aeration. So where is this contraindicated? The contraindication is in the suspected intratympanic. So suspected intratympanic glomus tumor. So suspected intratympanic glomus tumor. Next, we are going to look at the incisions. So what does this incisions include? So in incisions, in case of the acute suppurative otitis media, that is ASOM, a circumferential incision is made. So there is a circumferential incision which is made, and this is in the posterior-inferior quadrant. It's in the PI quadrant. There is a posterior-inferior quadrant, and this is of the tympanic membrane. And this happens midway between the handle of the malleus. It is midway between the handle of the malleolus and the tympanic annulus So it is midway between the handle of the malleus and the tympanic annulus, and avoiding the injury to the, and it avoids, so avoiding the injury, and this will be to the incudostapedial joint, to the incudostapedial joint. Then in case of the SOM, that is a serous otitis media. So in terms of the SOM, that is serous otitis media, there is a small radial incision. There is a small radial incision, and this is given in the anteroinferior quadrant, that is a AIQ, and all effusion. So what happens to this effusion? So if you look at this effusion, it is sucked out. The effusion is sucked out. Next, just showing a rough diagram. This is how the tympanic membrane looks, and this will be the posterior end, this will be the anterior end. So in case of the circumferential incision, this is nothing but the circumferential incision. So it is a circumferential incision. It is used in case of the ASOM. And next will be the radial incision. This is nothing but the radial incision, and this is in the SOM, and this is the anterior part. So this is just a visual representation of where it is present. Next we move on to the complications of the myringotomy. So in terms of the complications, it includes, firstly there is injury. So injury to the incudostapedial joint. So incudostapedial joint or the stapes. Next is there is injury. There is injury to the jugular bulb. So there is injury to the jugular bulb, and this is with the profuse bleeding. The profuse bleeding. And if the jugular bulb is high, in case the jugular bulb, this is high, and the floor of the middle, so this is if the jugular bulb is high and the floor of the middle ear dehiscent, and floor of the middle ear dehiscent. Next will be complications is the middle ear infection. So this was all about the myringotomy. So we saw the indications and we named a few and explained the ASOM. Then we also saw the contraindications, incisions. We also saw diagrammatic representation, and we highlighted upon the complications. To learn and grow daily like this, please do subscribe.